Hi, I'm Michael Wilker with ASPA. I'm here today talking with a legend who's worked for HHS for 43 years, Bill Hall. How you doing?
Doing fine. Thank you, Michael.
Thanks for
nice
sitting
to be
down
here with you.
All
Absolutely.
Right. Let's get started with the early life of yours. Where'd you grow up and where'd you go to school?
So I grew up in Baltimore, Maryland, and then went to college in St. Lawrence University in upstate New York. And then after that, went to grad school at University of Maryland, to journalism school.
What did you study at St. Lawrence?
I studied biology. I've always loved science, health, medicine, and thought I might want to be a doctor. And so I majored in biology, took all kinds of science classes and courses. And while I was in college, the college has two radio stations that they operate. So I got involved in that just as sort of a side thing, and I thought, this is a lot of fun, and that's what I really want to do. So I decided that's when I needed to go get an academic background in journalism and communications, and I went to University of Maryland, which was located in Washington. I thought, what better place than Washington to study journalism and news. So.
Okay. All right, and then so from there, what drew you to public service? How did you get into the government game?
Well, it wasn't by a plan. It all happened through serendipity. So while I was at University of Maryland studying for my master's, I saw an ad for a job, a part-time student job at the National Institutes of Health. Not a place I was too familiar with. I'd heard of it, but didn't know a whole lot about it. I applied. They hired me. At that time, the Reagan administration had just come in, and they were downsizing government. And so they were laying off a lot of freshly hired federal employees. Because of my student appointment role, it was exempt. So I ended up getting to stay on for a couple of years until after all that was over. At that point, they offered me a permanent role, permanent job, and accepted it. And so that's how I got to NIH in a communications office there, small communications office, doing news writing, public information work, and got to learn and explore NIH as an agency, and just loved what they did. And ended up being there for 18 years in a series of higher level positions, and really got to, I think, hone my skills in being able to distill science, complex scientific information and concepts for the public and for the media. And it began to dawn on me that I'm really doing what I really love, communications, which I kind of fell into serendipitously at college, and my love of biology and science. And they just came together without me really planning for that to happen. So.
The way life should be.
Exactly,
yeah.
Exactly.
What kind of things did you do? What kind of tasks were you doing at NIH?
So I worked in a small communications office to start with. It was the division that did all the computer support for the agency, and not, I don't mean just like email and so forth, but they did modeling for a lot of the scientists. They had very powerful computers. This was back in the early 1980s, so the entire first floor of this building was taken up with a big mainframe computer. Probably has less memory than your smartphone today. So that was kind of fun, and got to experience some of the technical things that NIH was doing. Then I moved to the Diabetes and Digestive and Kidney Disease Institute and got to do a lot more media there, and really got to sort of expand my horizons. And then finally I moved to the Office of the Director, where I worked in covering a particular program called the Consensus Development Conference Program. Basically, NIH brought together these outside juries of independent experts to review current scientific evidence to make some decisions on clinical care guidelines for hot-button issues at the time. So like breast cancer and mammography, Gulf War illness, noise and hearing loss, things like that. And so with each one of those, we held a huge press conference at the end of these 3-day conferences. So that really got me into working with the media and running some large-scale news operations for the agency.
Cool. So you said you started in the Reagan administration. So how many administrations have you worked with?
Technically, when I started, Jimmy Carter was still president.
Oh, all right. Okay, all right.
So it's 8 administrations,
And how many secretaries?
13 secretaries, which I counted is just over half of all of the secretaries that have ever served in the department. So, yeah.
Okay, that's a number.
It's a few years.
So, 43 years, what are some of those major changes from when you started, both, I guess, technology and then how the job you do now?
So clearly, back then, we didn't have email, we didn't have the web, there was no social media. CNN had only been on the air for 5 months. So cable TV, cable news was just starting to come into play as well. So in those early years, our focus was on the big three networks, and major newspapers, local papers, and so forth. So today, they're just one piece of the big pool of all of the outlets that convey news, whether they're website outlets, social media outlets, and so forth. So that's probably been the biggest change.
There's a sign in your office that says reporters only. Tell us a little bit about that sign.
So years ago, actually before I came to the department, there was a room up on the 6th floor in the Office of Public Affairs suite that was set aside for reporters who could come into the building, sit down, do some of their writing, interview people. And so that sign, it says room for reporters only and phone for reporters only. And it dates back to, I think, probably the 1950s. Obviously, we don't have reporters roaming around the building anymore today.
Yeah, but it's interesting though that's how we got news out. Sometimes.
Yeah,
AP was here.
They were right there,
day.
right down the hallway. And if you had a breaking story, you go down the hallway and come into my office. Let me tell you about it. So yeah.
I know you have a lot of memorable days out of your career. What can you give me one or two that these are the ones that come to mind right off the bat?
I think the one that comes to mind right off the bat is September 11th, 2001. I probably remember more of that day than any other day in my career. We were all up in the public affairs office that morning. We heard the news about the first plane. We had the TVs on. We all saw the second plane hit. The windows of the public affairs office face west outside the building. And we were standing in an office by the window, so we just turned and looked. And in the distance, we could see the black plume of smoke right in the direction of where the Pentagon was. And so we knew at that point, people were getting very, very scared about what was happening that day. Later that day, I think OPM had basically released everybody to go home who wanted to go home. There were probably about a half a dozen of us in ASPA that stayed, along with other senior officials throughout the building who stayed. I think I went home the following morning around 1 or 2 o'clock. I think I talked to more than 50 reporters, 60 reporters that day, calling to find out what our response was, what we would be doing. So that's probably the day that stands out the most of any in my career.
And what was your role after that?
So I was asked to go to New York City to support communications on behalf of HHS. FEMA, at the time, there was no Department of Homeland Security. FEMA was leading the federal government's response in New York City. So I was asked to go up and represent HHS. So I was up there for about 10 days, I think, and really worked with the media on site there to tell our story about what we were doing in New York, helping with the mental health issues, family reunification issues. We even had a team up there taking care of the search and rescue dogs, the veterinary team. And they ended up doing a lot of work rescuing pets in a lot of the apartments throughout that area of Manhattan. So that was kind of a different angle to the whole thing. Got a lot of media interest in that too.
Since 9/11 was that kind of seminal point, what were there certain initiatives or things that came out of that experience for the government and for HHS that you were part of?
So 9/11, and then a few weeks after, if you recall, we had the anthrax attacks in October of that year. Those two events really brought me into the world of emergency and communications, crisis communications response and preparedness. And it taught me how critically important public communications is as a tool in responding to emergencies, health emergencies in particular for us. And that's became my passion, and it's really what I spent a lot of my focus on in the subsequent years, and led the response, from the public health perspective, to a lot of outbreaks, Zika, Ebola, H1N1, West Nile virus, SARS, and even all the way up to COVID-19. And so a lot of my work, besides outside of my position description, has been really leading the effort and working with a lot of other great people in the department to integrate crisis communications into all of our planning, emergency preparedness and planning, because sometimes it's the only tool you have at the very beginning of an emergency. You may not have vaccines, you may not have treatments, you may not even know exactly how the disease or the infection is spreading, but you have communications, and it can be a very powerful tool to help protect people in those early days.
And you've not only done that nationally, but globally too, correct?
Mm-hmm. So a few years after 9/11, our department, our secretary was talking with his counterpart in the UK and decided we need to be better prepared as like-minded countries. And so that ended up creating what was called the Global Health Security Initiative. The goal was to improve our collective preparedness and response capabilities and to protect each other and help protect the world. The deputy secretary at the time came to me and said, "Bill, we really need communications to be part of this work. Can you help us with this?" And I said, "Absolutely." And I actually had a very close colleague of mine in Health Canada, in the Canadian Health Ministry, reached out to her and said, "Here's what we're trying to do. Will you help me with this?" And so she and I together put together a communications work group of people, my counterparts from the health ministries at all of these countries throughout, the G7, the EU, and the World Health Organization. Each year, the health ministers themselves would come together and meet and talk about, the work that's been done. And that was an opportunity to sort of test them on communications and some of these challenges that they would face in some sort of outbreak or health emergency. And so based on my domestic experience running these tabletop exercises, I was asked to lead these kinds of exercises for the health ministers gathered at the table. Fascinating work.
Awesome.
Got to meet a lot of fascinating people too.
I'm sure. Yeah. Your passport must have been quite impressive.
I have a couple of iterations of my passport. Yeah.
When we were talking earlier, you talked about how to get things done. Not always the what gets done, but talk a little bit about the gears of government and how you've worked those, not so much to your advantage, but to make a better program.
Sure. In the early 2000s, the web was really kind of in its infancy, and it really was nothing like we know it today. At that point, I felt like the web was something that public affairs needed to own and manage, not our IT department. And so I came up with the notion that it should reside in ASPA. We should build a team of people to run it. You can have a nice looking website, but if you don't maintain it, it's going to gather dust pretty quickly. So the leadership at the time, I pitched them on the idea that, the web is like a newspaper. The content should be handled by the communicators, the people that know how to write it. They agreed with that. They said that makes total sense. So we ended up setting up a mechanism whereby all of the agencies of the department help fund the department's website, because it's really a tool for all of them.
So what's kept you here? I mean, a lot of people change jobs and change places where they work, but you have married HHS in a way. What's that?
Yeah. Well, I've changed jobs throughout my career, at HHS and at NIH too, of course. I think it's really our mission. It's what this department does. To me, it's the one department that touches the lives of every American in some way every single day of their lives, whether they know it or not. And I've always been very, passionate about public service, about giving back to my country. And just the mission of the department, I mean, after all, human is in our name. And that's what's kept me here all that long, is the ability to serve the American people in that way.
You can, sir.
Absolutely. Thank you.
produced by the U.S. Department of Health and Human Services.